As students head back to class, health officials say they don't have the full picture. That's because Montana is one of only 2 states not reporting vaccination data to the CDC. NBC Montana's Michael Sanaskoy is working for you, investigating what that means for your community.
The CDC recently released new national and state-level vaccination data. NBC Montana found 2 states didn't submit their numbers, including Montana.
Without that available data, we just, again, don't have an ability to really dive into some of the risks that could be presented should a particular disease present itself in our community.
Christenson says the Gallatin City-County Health Department does not have county or statewide data that includes all residents in the community. Some information is available through the state immunization registry, but only if people opt in.
Because we don't have all residents, it can be really difficult for us to assess the coverage rates, vaccination coverage rates, and thus potentially the risk level for some of the vaccine preventable diseases.
I reached out to the CDC to learn why this data matters at a national level. I received this response from a CDC spokesperson saying, state and local health departments are on the front line of public health and need the data to track outbreaks, understand vaccine coverage in terms of increases and decreases, and preparing public health responses. Local data on vaccination coverage and exemptions is particularly important in helping to identify potential issues. I also reached out to the Montana Department of Public Health and Human Services to find out why the state of Montana stopped reporting its vaccination numbers to the CDC. The communications director with DPHHS told me the agency no longer collects school data after the passage of House Bill 334 in 2021. The last school immunization report was made in the 2018-2019 school year. The bill revised medical exemption laws for student immunization requirements, including new requirements for exemption forms. During that session, some Montanans shared strong views about vaccinations.
Never had a reason to question vaccine safety until I saw with my own eyes how they affected my children over the years. All of my vaccinated children had several severe reactions and injuries.
Vaccines are our most successful public health venture, so we are fully supportive of vaccinations.
I reached back out to the CDC spokesperson to ask follow-up questions like if the agency has seen cases where vaccinations has caused children to experience development issues. What specifically is in vaccinations for infants and toddlers? Is this leading to vaccination hesitancy? I didn't get a response before airtime. Christenson says her team focuses on understanding parents' perspectives as they decide what's best for their children.
So they're making decisions based on what they know and also what their beliefs are. And so we really come from a place of empathy to try and understand where that hesitancy or the unavailability of information may be coming from and try and address that as best as we can.
Even without statewide data, Christenson says the Gallatin City-County Health Department is prepared to respond to an outbreak. You can find more resources in my article at nbcmontana.com. In Helena, Michael Sanaskoy, NBC Montana.